one.
There you go.
All right, today KUTV has a special Ask the Expert for you. We have professionals standing by ready to take your questions from St. George at the Intermountain Cancer Clinic.
But here in studio, we are joined by Dr. Tae Kim. He's an oncology surgeon at the Intermountain LDS Hospital. And today we're talking about the second leading cause of cancer-related deaths. Now, what is it?
Colon cancer.
Now, what is March?
So March is Colon Cancer Awareness Month, where we advocate people get their colonoscopies.
Okay, and
what should we be doing to trying to prevent cancer, which is get screened, right?
Correct. So anyone over the age of 50 needs to get their colonoscopies.
now let me ask you this, and maybe it's just because I'm naive, but when we always think of colon cancer, we usually associate it with men. Do we do the same with women?
Yes, so women are at risk as well. Men have a higher rate of getting precancerous polyps, so they're about a 25% chance for first-timers to have something that needs to be removed, but women have a little bit less than 20%.
So what are the symptoms? Are there symptoms with colon cancer?
Unfortunately not. That's why we recommend getting to colonoscopies, because you want to catch it before you get symptoms.
Now, do you think people are not getting the screening done out of embarrassment?
We think so, because about 60% of people are getting colonoscopies, but that's 40% that's not. That's a huge number. And people think it's uncomfortable, it's embarrassing, but really you get a really nice nap, you get some propofol-induced sleep, you know, and then it really is a simple process. You'll be in the hospital for about 2 hours or so. There really shouldn't be a reason to not get one.
Yeah, because it's a process that can save your life.
Absolutely.
What are factors that play into getting colon cancer, like family history, diet? What do we know about colon cancer?
Yeah, so the biggest risk is age, and we can't control that. So anyone over the age of 50 is at risk, and over a lifetime risk is about 4%, but that risk increases the older you get. And about 10 to 20% of all colorectal cancers relate to family history. So if you have a first-degree relative, that's the highest risk, but then every generation thereafter also increases your risk.
How curable is it if you catch it in the early stages?
If you catch it before it becomes cancer, it's 100% preventable. It's not even curable. It's not a disease to cure. But if you do get colon cancer, if we catch it early, cure rates are anywhere from 90 to 95%.
And a lot of times when screening for colon cancer, you're looking for those polyps. So that's before it's cancerous, right?
Correct. And so this is my push for colonoscopies. You know, everyone is more than happy to get their mammogram for the pink ribbons, you know, but for the blue ribbons, the advantage of colonoscopy is we can prevent cancer versus mammography. You diagnose cancer at an early stage, you can't prevent. So we think with the advent of colonoscopies, we are actually making a dent in colon cancer. Over the past 10 years, there's a little bit less colon cancer than there was, but still we have 40% population to get on board with this.
And as you can see, we've got experts standing by all day to answer your questions. So once again, one last push, why should everybody go out there and get their colon checked?
Because it's a disease that you can prevent, and you certainly don't want to die from colon cancer.
Yeah, when it is preventable.
Absolutely.
Okay, doctor, thank you so much. So we do have experts standing by in St. George. You can call this number, 435-251-3123. And experts today, they're standing by in St. George to take any of your questions.